Now, in an environment where most of the people that are getting coronavirus are asymptomatic or have light symptoms, is that an environment where it just becomes much, much more likely that not just the South Africa variant, but other newer, more competitive variants for transmissibility are just going to be a reality?
Well, not necessarily. First of all, you got to understand this is mostly driven by human behavior rather than the lack of resources in low-income countries. India was on the same pathway the United States was on. It was about to become the #1 source of virus in the world. And then in September, they had a concerted campaign to get people wearing masks. They have incredibly low rates of circulation. They put our country to shame. So what I would say is that where you have wide amounts of virus circulating, because there has not been a concerted effort, we see that in Brazil, to wear masks and get the basic measures into place, those will be places that are sources of more mutation.
We see it in Brazil, we see it in South Africa, we see it in the United Kingdom, the three places where I've heard broadly named variants. That is not coincidence, I take it.
That is not coincidence. It is precisely those places where we've had a substantial amount of increase in spread. The variants are driving more hospitalizations and deaths, mainly because of just being more contagious. Now, the good news is Israel has already hit high enough levels of vaccination that they're seeing a drop in infection rates and hospitalizations. And it's significant because Israel is about half the UK mutant virus. So that means that the Moderna and Pfizer vaccines they've received are effective against the UK variant. That's the one that in the United States is also spreading quickly. We're in a race to get people vaccinated to provide that protection, even against some of these variants. The South African and Brazilian variants are more concerning for evading some of the vaccine protection.
Now, Israel, a tiny population, about 7 million people, but over 50% of all Israeli citizens at this point have gotten at least one jab. What else have we learned? Because we're many months away from that in the United States, but we're on that trajectory. What have we learned so far from Israel that will be applicable here in the United States?
So a couple of things we've learned from Israel. Number one is that, buy the vaccine in large quantities early, and they got those commitments, so they got the supply they needed. Second is they're a country that have universal health care coverage. Everybody has a doctor and are enrolled in well-organized systems so that they could identify the high-risk groups, notify people to get in, and then work with the doctors and the health system to enable the delivery. That is what we did not do.
We've talked about some of the vaccines in the United States. Of course, in the world, the Chinese vaccine is going to be what a lot of people are experiencing, or Chinese vaccines. How confident are we that the Chinese vaccines, the Russian vaccines, are going to be suitable for purpose as they start producing and exporting in large numbers?
We really need to see more of the data. And the measure to me, everyone's been focused on the effectiveness against the virus on a overall level. But as I alluded to earlier, the critical measure is how much do they avoid serious illness? And these vaccines in China, also being produced in Russia, there's one that also we haven't seen clinical data on that's being distributed widely in India. Those are going to be, seeing what the actual effect is on the rates of hospitalization and deaths is the critical thing. You can see this shut down the spread of very serious disease and dangers to the healthcare system, not to mention people's lives. That could happen still with these vaccines. We just haven't seen the data.
Any reason to believe that, again, you're seeing this all over the world right now, if you're getting a Sputnik V vaccine as opposed to nothing in a country like Argentina, your view would be take it, or actually we just don't know?
My view on it is we just don't know. It's a problem that vaccines are moving out, that the public hasn't been given a chance to evaluate what the actual data is. When it comes to Moderna, Pfizer, Johnson & Johnson, Novavax, there's a transparent process with FDA getting to review the actual raw data itself to see that, it isn't doctored, that it's being interpreted correctly, and they're in well-run trials where you can see what the results are and know that they are safe and that they are effective. With these other vaccines that are being distributed in other countries in the world, that information's not been available, and you are seeing significantly higher rates of hesitancy about taking those vaccines in those environments. It's a straightforward thing. You just have to be more transparent.